Hey, I'm Erin, and my speech is titled, Should Assisted Suicide Be Allowed for Terminally Ill Patients? Did you know 1.2 million people are diagnosed with cancer annually? More than 300 people die from committing suicide due to terminally ill diseases, based off an article by Bingham in 2014. I believe assisted suicide should be allowed. No one wants to suffer a long and painful death. If you could choose how you died, I guarantee it would not have anything to do with cancer. If you were suffering from a terminally ill disease, what would you do? What if you were going to die a long, painful death? Would that change your mind? I don't think it's right to have to sit there and watch someone die a long, agonizing death caused by a terminally ill disease. There is enough suffering in this world. Many people think that assisted suicide is murder. In reality, it is. But think about it. Would you really want to have someone giving you a bath because you couldn't do it yourself? Or every time you go to the restroom, someone having to wipe you? What dignity could someone still have after going through that? Not very much. That's why, in 1994, Oregon passed the Death with Dignity Act. The Death with Dignity Act allows a physician to prescribe a lethal dosage of medication. According to the Death with Dignity National Center and Death with Dignity Political Fund website, Death with Dignity institutes allow mentally competent adult state residents who have a terminally ill disease with a confirmed prognosis of having 6 or fewer months to live to voluntarily request and receive a prescription medication to hasten their inevitable imminent death. Did you know that 1 out of 4 deaths in the United States is caused by cancer? In January of 2014, Brittany Maynard, age 29, was diagnosed with terminal brain cancer and was told she only had 6 months to live. Maynard then decided she didn't want to die a long, painful death. She wanted to die with dignity. Maynard and her family then decided to move to Oregon, where the Death with Dignity Act originated. In my opinion, if someone is suffering and there's ways to help them feel better about what is happening to them, wouldn't you want to help them? What if it was you going through it? Not everyone is for the Death with Dignity Act. However, I am. The definition of assisted suicide occurs when a physician provides a patient with medical means and/or the medical knowledge to commit suicide. These are the requirements in order to meet Oregon's Death with Dignity Act. First, patients must have 6 months to live. 2, must have 2 physicians to sign off. 3, both physicians have to agree. And 4, patient requests prescription again 15 days after the initial request. These are the people protesting for the Death with Dignity Act. This is the People magazine issue where they spoke with Brittany Maynard. The Brittany Maynard Fund was created to help support the Death with Dignity Act. These are the most frequent reasons for assisted suicide. 96.2% is from decreasing ability to participate in activities that are enjoyable to life. 92.4% is loss of autonomy. 75.4% is loss of dignity. This is Brittany Maynard's final post on Facebook telling everybody she loved goodbye. I'm Erin, and I am for the Death with Dignity Act.